Last week, we talked about the three layers that are involved with branding and positioning your new medical practice. Today, we're going to focus specifically on the bottom base of this pyramid, which is the brand identity. So stay tuned to learn how exactly to establish the brand identity for your telemedicine company. Hi, I'm Dr. Annie DePasquale. I'm the owner of Collaborating Docs. We help nurse practitioners find excellent collaborating physicians. And today we're talking all about brand identity. So as a quick reminder, your brand identity is what makes up all the characteristics and attributes of your business that is going to help inform future key decisions. So who is your audience? What services are you offering? How are you going to stand out from the crowd? So to dive a little bit deeper, your brand identity should relay and be an extension of the patient experience. So however you want your physician to feel when they come to you for a visit is how you're going to establish your overall brand. You're also going to need to be very specific in your branding. So you need to be crisp and cohesive, and that is going to relay professionalism. It's going to build trust with your patients and establish your reputation. So this all has to be done before you start seeing patients. You need to have a clear vision of your brand, so then it is reflected in everything you do and attracts the correct type of patient that you're looking for. Brand identity is going to be a list of unique attributes that sets you apart. So do you want to be known as the most friendly, personable nurse practitioner that helps geriatric patients? Or do you want to be known as the most insightful, intelligent, sort of cerebral provider out there? These are decisions that you will be having to make regarding your own personal brand and the practice you're trying to build. So you do need to establish this early on before you do anything else, because it is going to inform those future business decisions. So it's a good time. I often suggest taking a long walk to really reflect on how do you want to be portrayed. What do you want to be known for? It's essential to set that from the get-go. Then you do want to look at competitors to see what is perhaps working for them and what isn't. How do you want to be perhaps similar to them, or maybe completely the opposite? So you want to be very aware of the other people and practices in your niche and sort of maybe take the good, leave the bad, so you can become the best that you possibly can. You definitely want to go with your gut and what you know about your patients. So if you know your patient population is going to value professionalism most of all over anything else, then that must be one of your key attributes. And I really like this chart. So it's sort of a continuum of different things to consider. So on the top, do you want to be more personable and friendly, or do you want to be more corporate and professional? Second, do you want to be spontaneous, high energy, or do you want to really carefully think through things, plan things out? Do you want to be modern, high tech, or more classic, traditional? Do you want to be cutting edge or established? Do you want to be fun or serious? Do you want to be accessible to everyone or exclusive? So this is a good chart to go through for yourself, thinking about how you want to set up your practice. So in the example where the pink lines are, this example practice is definitely more on the personable, friendly, fun side of things. So that's going to influence things in the future, like unique service offerings. To be fun, friendly, personable, you might go to community events and have a table at a health fair and get out there and hand out treats and talk to families and kids and have that sort of personable, fun demeanor. Also, even just coloring of your branding. So if it's fun, friendly, bright, light colors. So hopefully this gives you an idea of the things you want to be thinking through as you're setting that baseline brand identity. If you need any help finding a collaborating physician, we're happy to help at Collaborating Docs. The link is in the description below. I wish you much success. See you next time.